Your eyes often show warning signs long before serious diseases become fully visible in the body, and doctors frequently emphasize that vision changes should never be ignored, especially after 50, because the eyes are directly connected to blood vessels, nerves, brain function, and metabolic health, meaning even subtle shifts in sight can sometimes reflect deeper internal problems that are developing silently. And one of the most important changes to understand is sudden or gradual blurry vision, which many people dismiss as normal aging or tired eyesight. But medical experts explain that persistent blurriness can sometimes be linked to conditions like diabetes, where high blood sugar damages tiny blood vessels in the retina, reducing clarity and causing fluctuating vision that may come and go throughout the day. And this is not just an eye issue, but a circulation and metabolic warning that the body is struggling to manage glucose properly. And another serious vision change is sudden difficulty seeing in low light or at night, which doctors often associate with vitamin deficiencies, early cataract formation, or even retinal changes that affect how the eye adapts to darkness. And many older adults simply assume they need more light. But in reality, the retina may be losing sensitivity, which can also be linked to aging-related degeneration or chronic health conditions affecting nutrient absorption. And another critical warning sign is the appearance of dark spots, floaters, or sudden flashes of light in the vision field, which can sometimes be harmless, but in other cases may indicate retinal detachment or vitreous changes. And doctors warn that if these symptoms appear suddenly or increase rapidly, they should never be ignored because they can lead to permanent vision loss if not treated in time. And another important change is double vision, where objects appear duplicated or misaligned. And this is especially concerning because it is not just an eye issue but can sometimes be linked to neurological conditions such as stroke or nerve dysfunction affecting eye muscle coordination. And medical experts emphasize that sudden double vision, especially when combined with dizziness, weakness, or confusion, requires urgent attention because it may reflect reduced blood flow to the brain. And another subtle but dangerous sign is gradual loss of peripheral vision, where a person begins to feel like they are seeing through a narrowing tunnel. And this can be associated with conditions like glaucoma, where increased eye pressure damages the optic nerve slowly and silently without pain in the early stages, which is why it is often called a silent thief of sight. And many people do not notice this change until significant vision is already lost, making regular eye checks extremely important after 50. And another vision-related warning is frequent eye strain, headaches, and discomfort while reading or using screens, which may seem harmless but can sometimes reflect uncorrected vision problems, blood pressure fluctuations, or even neurological stress. And doctors explain that when the eyes constantly struggle to focus, it increases strain on surrounding muscles and nerves, which can lead to persistent headaches and fatigue that are often mistaken for general aging or stress. And another important symptom is yellowing or redness in the eyes, which can sometimes indicate liver dysfunction or inflammation in the body, because the whites of the eyes often reflect changes in bilirubin levels and blood circulation. And when the liver is not processing toxins properly, subtle discoloration can appear before more obvious symptoms develop, making the eyes an early indicator of internal organ stress. And another serious change is temporary vision loss or sudden dimming of vision, even if it lasts only a few seconds, which doctors warn may be related to reduced blood flow to the brain or retina, sometimes called transient ischemic attacks. And this can be a warning sign of increased stroke risk, especially in older adults with high blood pressure, cholesterol issues, or heart disease. And these brief episodes should never be ignored because they often signal that circulation is being interrupted somewhere in the vascular system. And finally, another key vision change is difficulty focusing or adapting between near and far objects, which may seem like simple aging of the eyes, but can also be linked to diabetes, related lens changes, neurological slowing, or cataract development. And doctors explain that when the eye's ability to adjust focus weakens, it can significantly affect daily life tasks such as reading, driving, and recognizing faces. And while many of these vision changes can have simple explanations like aging or eye fatigue, the important medical truth is that the eyes are often the first place where systemic diseases quietly reveal themselves because they contain some of the smallest and most sensitive blood vessels in The entire body, meaning that conditions affecting circulation, nerves, metabolism, or inflammation often appear here earlier than anywhere else. And this is why specialists consistently stress that any persistent or unusual change in vision should not be dismissed as normal, aging without proper evaluation, especially when multiple symptoms appear together, such as blurriness combined with headaches, floaters combined with flashes, or vision changes combined with dizziness or fatigue, because patterns matter more than isolated moments, and the body often communicates through these patterns long before a serious health event occurs. And maintaining eye health after 50 is not only about wearing glasses or getting regular checkups, but also about understanding that vision is deeply connected to overall vascular and neurological health. So, protecting the eyes often means protecting the heart, brain, and metabolic system at the same time. And doctors frequently remind that early detection is the most powerful tool available because many eye-related complications can be slowed, managed, or even prevented if addressed in time. But when ignored, these small warning signs can gradually progress into more serious conditions that affect independence, safety, and quality of life, which is why paying attention to these subtle vision changes is not about fear, but about awareness and timely action that can make a real difference in long-term health outcomes. Another important vision warning doctors often emphasize is sudden sensitivity to light, where normal indoor lighting or sunlight starts to feel unusually harsh or uncomfortable for the eyes. And while many people assume this is just aging or dryness, medical experts explain that increased light sensitivity can sometimes be linked to inflammation in the eye, corneal issues, migraine-related neurological changes, or early retinal stress. And after 50, the eye's natural protective mechanisms like tear production and lens clarity gradually weaken, which can make this symptom more noticeable. But when it appears suddenly or worsens over time, it should not be ignored because it may indicate that the eye structures responsible for filtering and focusing light are under strain. And in some cases, this change can also be connected with systemic conditions that affect nerves and blood vessels supplying the eyes. And another subtle but important change is frequent dryness or a gritty sensation in the eyes, which many older adults experience and often dismiss as normal aging. But doctors explain that chronic dry eyes can reflect reduced tear gland function, hormonal changes, medication side effects, or even autoimmune conditions that affect moisture production throughout the body. And when the eyes are not properly lubricated, vision can become unstable, blurry, or temporarily distorted, especially during reading or screen use. And this constant irritation may also lead to reflex tearing, where the eyes water excessively as a response to dryness, creating a confusing cycle that many people misunderstand as normal eye fatigue. But in reality, it can significantly affect visual comfort and clarity over time. And another important warning sign is difficult recognizing faces or distinguishing fine details, which may seem subtle at first, but can indicate changes in central vision, often linked with conditions like macular degeneration, where the central part of the retina slowly deteriorates, affecting sharpness and detail perception. And doctors explain that this type of vision change is particularly concerning because it directly impacts daily independence, making it harder to read, drive, or identify people clearly. And it often develops gradually, so individuals may not notice until significant changes have already occurred, which is why regular eye screenings become critical after 50, even in the absence of obvious symptoms. And another serious sign is uneven vision between the two eyes, where one eye begins to see more clearly than the other. And this imbalance can sometimes indicate cataracts developing at different rates, retinal issues, or nerve-related problems affecting one side more than the other. And over time, this can strain the brain as it tries to merge two different visual signals into a single image, leading to headaches, dizziness, or fatigue. And doctors often stress that even small differences in visual clarity between eyes should be evaluated because they may point to underlying structural changes that are not immediately visible. And another concerning change is distorted vision, where straight lines appear wavy or objects look slightly bent or stretched, which can be a key early sign of retinal problems, particularly in the macula region, responsible for sharp central vision. And this symptom is especially important because it often appears before significant vision loss, making it one of the earliest detectable indicators of serious retinal disease. And another important warning is frequent changes in prescription strength for glasses within a short period of time, which many people assume is normal aging. But doctors explain that rapidly changing vision can sometimes reflect unstable blood sugar levels, cataract progression, or underlying metabolic conditions affecting the eye's lens. And this instability suggests that the internal environment of the eye is changing faster than normal aging would explain. And finally, another subtle but very important sign is seeing halos around lights, especially at night, which can indicate changes in the cornea or lens clarity, often associated with cataracts or increased eye pressure. And while it may start as a mild visual disturbance, it can gradually affect night driving safety and overall visual comfort. And doctors emphasize that the key concern with all these vision changes is not just their individual presence, but their pattern. Because when multiple symptoms appear together, such as dryness, blurriness, light sensitivity, and focusing problems, it often suggests that the eyes are not just aging normally, but may be reflecting deeper systemic issues affecting circulation, nerves, metabolism, or inflammation in the body. And this is why eye health is often considered a window into overall health, because the same tiny blood vessels and nerves that affect vision are also involved in brain function, heart health, and metabolic balance, meaning that protecting vision is not only about preventing blindness, but also about identifying early warning signals that can help protect overall well-being. And doctors consistently remind that early attention to these subtle changes allows for far better outcomes than waiting until vision becomes severely affected, because many eye conditions progress silently but respond well to early intervention, making awareness one of the most powerful tools for preserving sight and long-term quality of life. It's also important to understand another serious vision change that doctors often associate with underlying health problems, which is gradual narrowing of visual awareness in daily life, where a person begins to feel like their side vision is slowly becoming less noticeable, even though central vision still feels normal. And this is particularly concerning because the brain can sometimes compensate for slow changes in peripheral vision, making it harder for individuals to notice the problem early on. And medical experts explain that this type of vision loss is often linked with conditions like glaucoma, where increased pressure inside the eyes slowly damages the optic nerve without causing pain in the early stages. And what makes this especially dangerous after 50 is that people may continue daily activities normally while significant damage is happening quietly in the background. And by the time symptoms become obvious, a large portion of vision may already be permanently affected. Which is why regular eye pressure checks are considered essential even when no discomfort is felt. And another important but often misunderstood change is intermittent vision, fogging, where vision becomes clear at times but suddenly turns hazy or clouded without a clear reason. And doctors explain that this can sometimes be linked with unstable blood sugar levels, early cataract development, or temporary changes in fluid balance within the eye. And many people assume it is just tiredness or lack of sleep. But repeated episodes of visual fog can indicate that the eye's internal environment is not stable, especially in older adults where metabolic regulation naturally becomes less efficient. And this is why doctors often look at vision fluctuations as potential clues to broader health issues rather than isolated eye problems. And another serious warning sign is persistent eye twitching or involuntary muscle movements around the eyes, which many people dismiss as stress or fatigue, but medical experts explain that chronic twitching can sometimes be associated with nervous system imbalance, magnesium deficiency, high stress hormone levels, or even early neurological strain. And while occasional twitching is usually harmless, persistent or worsening symptoms should not be ignored, especially when combined with other vision changes, because it may reflect that the nervous system is under continuous stress. And another important symptom that often goes unnoticed is difficult adjusting vision between different lighting environments, such as moving from bright sunlight into a dim room or vice versa, where the eyes take longer than usual to adapt. And doctors explain that this can indicate aging changes in the lens or retina, but it can also be linked with vitamin deficiencies or early degenerative changes in the eye's ability to process light efficiently. And after 50, this adjustment process naturally slows down. But when the delay becomes pronounced, it may affect safety, especially during activities like driving at night or walking in low-light environments. And another critical vision change is the appearance of a gray curtain or shadow moving across part of the visual field, which doctors strongly warn should never be ignored because it can be a sign of retinal detachment or serious vascular blockage affecting the eye. And this symptom is often painless, but requires immediate medical attention because delaying treatment can lead to permanent vision loss. And another subtle but important sign is increased difficulty reading small print even with glasses, where words may appear blurred, distorted, or require more light than before. And this may not only reflect normal aging, but can also indicate progression of cataracts, macular changes, or reduced focusing ability due to lens stiffness. And many older adults compensate by increasing light or holding reading material further away. But doctors explain that this adaptation often hides gradual progression of underlying eye conditions. And another important issue is frequent eye redness or visible blood vessels becoming more prominent, which may seem minor but can sometimes indicate chronic irritation, dry eye syndrome, high blood pressure effects, or inflammation in the eye surface. And when this redness becomes persistent rather than occasional, it should be evaluated because it may reflect ongoing stress in the eye's protective layers. And finally, another very important vision-related warning is sudden loss of vision in one eye, even if it lasts only a few minutes, which doctors classify as a medical emergency because it may indicate temporary blockage of blood flow to the retina or brain, often described as a mini stroke affecting vision. And this is one of the strongest warning signs that the body may be at risk of more serious cardiovascular or neurological events in the future. And what ties all of these vision changes together is the fact that the eyes are not separate from the rest of the body, but are deeply connected to the brain, heart, blood vessels, metabolism, and nervous system, meaning that even small changes in vision can sometimes reflect larger internal imbalances that are still in early stages. And doctors consistently emphasize that the most important step is not panic, but awareness. Because when these signs are recognized early, there is often a much better chance of slowing progression, protecting vision, and identifying hidden health issues before they become more serious. And maintaining eye health after 50 is not only about correcting eyesight, but about understanding that vision is one of the body's most sensitive warning systems, constantly reflecting what is happening inside long before other symptoms appear. And paying attention to these subtle signals can make a significant difference in preserving independence, safety, and overall quality of life in the long term. Continuing further, another important vision warning that doctors frequently emphasize is sudden increase in eye floaters, combined with brief flashes of light, especially when these changes appear quickly over a short period of time. Because while a few floaters can be normal with aging as the gel inside the eye naturally changes consistency, a sudden shower of floaters or repeated flashes may indicate that the vitreous inside the eye is pulling on the retina. And in some cases, this traction can lead to a retinal tear if not evaluated promptly. And what makes this particularly important after 50 is that the risk of retinal changes increases as the internal structure of the eye becomes less stable with age. So any rapid change in visual patterns should be taken seriously rather than dismissed as normal aging. And another closely related sign is the sensation of seeing stars or brief lightning-like streaks in vision, even when the eyes are closed or in dark environments, which doctors explain can sometimes occur due to mechanical stimulation of the retina or changes in the gel-like vitreous pulling on sensitive eye tissues. And although not every case is dangerous, persistent or worsening flashes always require medical attention because they can be an early indicator of retinal stress or detachment. And another subtle but important symptom is gradual loss of color intensity, where colors begin to look duller, less vibrant, or slightly faded over time. And many people do not notice this change because it happens slowly. But doctors explain that reduced color perception can sometimes be linked with optic nerve changes, cataract progression, or neurological conditions affecting visual processing in the brain. And because color vision depends on both eye health and brain interpretation, any noticeable decline in color clarity should be evaluated carefully, especially when combined with other vision changes like blurriness or reduced contrast. And another important warning sign is frequent difficulty with contrast sensitivity, where it becomes harder to distinguish objects from their background, especially in low light or foggy conditions. And this can make everyday tasks like walking on stairs, driving at night, or recognizing facial expressions more challenging, and doctors explain that contrast sensitivity is often one of the earliest functions affected in many eye diseases, sometimes even before noticeable vision loss occurs, making it a key early indicator that the visual system is under strain. And another significant change is persistent, watery eyes that seem unrelated to emotion or irritation, which many people assume is simply dryness or allergy. But medical experts explain that excessive tearing can actually occur when the eyes are extremely dry, causing the tear glands to overcompensate, or when the drainage system becomes less efficient with age. And in some cases, this imbalance can affect visual stability, causing intermittent blurring and discomfort. And another important symptom is difficulty focusing on near objects even with corrective lenses, where reading becomes increasingly tiring or requires more effort than before. And while this is commonly associated with presbyopia, doctors warn that when the difficulty becomes rapidly progressive or uneven between eyes, it may indicate additional issues such as lens changes, muscle coordination problems, or metabolic conditions affecting eye flexibility. And another serious but often overlooked sign is the appearance of darkening or shadowing in part of the vision that does not move away, which can sometimes feel like a fixed blind spot. And this is particularly concerning because it may indicate damage to the retina, optic nerve, or blood supply to the eye. And doctors stress that any persistent visual field loss should always be treated as urgent because early intervention can sometimes prevent permanent damage. And another important change is increased glare, sensitivity while driving at night, where headlights, streetlights, or reflections appear overly bright or scattered, and this can significantly affect driving safety and is often associated with cataracts or changes in the eye's lens transparency. And finally, another key warning sign is a general feeling that vision is not as sharp as before, even when standard eye tests appear normal, because doctors explain that early eye disease or neurological changes may not always be detected immediately through basic screening, and subjective changes in visual clarity often reflect subtle early dysfunction in how the eye and brain process images together. And what connects all these symptoms is the understanding that vision is not a single isolated function, but a complex system involving the eyes, optic nerves, brain processing centers, blood flow, and metabolic balance, meaning that even small changes in eyesight can sometimes provide early clues about broader health conditions developing in the body. And this is why eye specialists consistently stress the importance of paying attention to even minor or gradual vision changes, because the earlier these signals are recognized, the greater the chance of protecting long-term sight, preventing complications, and identifying underlying health issues before they become more serious and difficult to manage, especially after 50 when both eye structure and overall health become more sensitive to internal changes. Another important but often overlooked vision change is difficulty seeing clearly in bright sunlight, where instead of improving visibility, strong light actually makes vision feel washed out or uncomfortable. And doctors explain that this can sometimes indicate early lens changes inside the eye or reduced ability of the retina to handle light intensity properly. And after 50, the natural aging of the eye can reduce its filtering efficiency. But when light sensitivity becomes excessive or disruptive to daily life, it may signal that the eye's internal structures are no longer adapting smoothly to environmental changes. And another closely related warning sign is frequent squinting even in normal lighting conditions, which many people do unconsciously without realizing that it may reflect declining visual sharpness, because squinting is the body's natural way of trying to improve focus by narrowing the light entering the eye. And while occasional squinting is normal, frequent or increasing dependence on it may indicate worsening refractive errors, cataract progression, or other structural changes affecting clarity. And another important symptom is difficulty judging distance or depth perception, where simple tasks like walking downstairs, pouring liquids, or reaching for objects become less precise. And doctors explain that depth perception depends on both eyes working together in perfect coordination. And when even small imbalances occur between the eyes, the brain struggles to merge images accurately, leading to misjudgment of distance, and this can increase the risk of falls or minor accidents. especially in older adults where balance and reaction speed are already reduced. And another subtle but important sign is frequent eye fatigue that occurs even after minimal visual effort, such as reading for a short time or watching television. And this fatigue may feel like heaviness, strain, or a desire to close the eyes frequently. And doctors explain that this can sometimes reflect weakened eye muscles, uncorrected vision problems, or underlying neurological strain affecting visual processing efficiency. And after 50, the muscles responsible for focusing naturally lose flexibility. But excessive fatigue beyond normal aging should still be evaluated, especially when it interferes with daily activities. And another concerning change is increased difficulty distinguishing objects in crowded or complex visual environments where the brain struggles to filter important visual information from background clutter. And this can be particularly noticeable in busy places like markets, roads, or social gatherings. And doctors explain that this may reflect early changes in visual processing pathways or reduced contrast sensitivity, both of which are important for safe navigation and spatial awareness. And another important warning sign is the feeling that letters or lines appear to move, shimmer, or distort slightly when trying to focus, which can sometimes be linked with retinal irregularities or macular stress. And although it may start subtly, this type of distortion often progresses if underlying conditions are not addressed early. And another significant symptom is increased reliance on artificial lighting even during daytime, where natural light no longer feels sufficient for reading or detailed tasks. And doctors explain that this may indicate reduced retinal sensitivity or early lens clouding, both of which reduce the eye's ability to capture and process light effectively. And another important change is frequent eye discomfort when switching between near and far focus, such as alternating between reading and looking at distant objects.